Hello, my name is Khan, and today I will be doing a presentation on the multi-state outbreak of Salmonella typhimurium infections linked to tomatoes. I will be performing a six-step case analysis of the problem and provide my opinions regarding the onset of food-related diseases in the future. Let's get started. According to the World Health Organization, Salmonella is one of four key global causes of diarrheal diseases and is one of the most common foodborne illnesses in the world. It affects 550 million people annually, with 220 million of those being children under 5 years old. Symptoms of Salmonella usually occur 12 to 36 hours after ingestion of bacterium. They are generally mild, however, the dehydration resulting from diarrhea can be severe for children and elderly patients. Specifically in this case, the Salmonella typhimurium bacterium causes a fever and diarrhea that resolves after 1 week. It is important to note that Salmonella typhimurium is caused by a unique strain of bacterium and is in no way related to typhoid fever, which is caused by another bacterium. The outbreak caused 183 cases in multiple states, with most of them located east of the Mississippi River. From the number of patients who had clinical data recorded, 93% of them became ill within a span of 2 weeks. Fortunately, only 22 patients, which is 12% of cases, were hospitalized. There were no deaths. The Centers for Disease Control and Prevention is the main organization with a mission to develop and apply disease prevention and control activities designed to improve the health of the people of the United States. For a SWOT analysis of the case, strength is the CDC's quick response in controlling the situation by eliminating all contaminated tomatoes responsible for the outbreak. Weakness is that this incident proves that food safety protocols are not strictly enforced in all restaurants. This is an opportunity to further encourage basic food safety habits and protocols in the future. The threat is to food safety and the health of the community. One of the core issues regarding this case is the lack of regulations and enforcement of basic food safety protocols in all restaurants. This has the potential to affect more of the population if the situation and outbreak had not been efficiently controlled in time. Furthermore, another core issue is that individuals do not regularly practice food safety habits. The disease can be easily transmitted to others through contact with infected people. The first alternative solution I can provide is the implementation of a phage therapy, which involves the use of bacterial viruses or phages to attack a specific bacterium or narrow group of bacteria. It was found to reduce counts of Salmonella. However, the downside is that it is only effective when treated immediately. Therefore, it is limited in its scope of eliminating the threat of Salmonella and foodborne diseases. Another alternative solution is using a vaccine on livestock commonly associated with Salmonella. A previous study found that the RNA and protein isolated from ribosomes of the Salmonella typhimurium bacterium can be used as an effective vaccine. This is because the ribosomes are highly immunogenic. One recommendation that I would like to propose to limit food-related health problems in the future is to have more regular farm and restaurant inspections to ensure that their conditions meet federal standards. This limits the amount of produce infected with Salmonella distributed to outside markets. Another recommendation is the enforcement of a strict food safety protocol in every restaurant and business serving food. This will ensure that outside contact with the bacterium does not transmit itself to others via food that is handled. By monitoring both ways in which Salmonella can present itself and infect, it will lead to less cases in the future. The action plan is to first have local hospitals diagnose the health problem, which should take about 1 to 2 days. Next, the local public health agency will send teams of professionals to investigate the root cause of the disease, in other words, where and how it originated. This will take about 1 week if the outbreak is generally localized. Thirdly, once the root has been found, a shutdown is necessary in order to eliminate the source of the contaminated food and its means of distribution. This should take approximately 1 week. Lastly is the treatment of severe cases if necessary, which should take about 2 weeks until recovery. In my opinion, the issues surrounding foodborne illnesses and food safety regulations have their roots at agricultural farms responsible for food production. In order to limit the prevalence of food-related diseases, it is important to increase the standards of farms in terms of cleanliness and ways to prevent food infections. food-related infections. Additionally, regular farm inspections should be implemented to ensure that all operational food sources meet federal standards and are safely able to distribute produce to the population. As we come to an end, here are the sources I inquired in order to create my presentation. Thank you.